I'm Jamie Leonard. I'm student ID number 3345462. This is my fall 2019 semester. This is my AVMA task video number 1 for Veterinary Clinical Pathology 2, VTHT 2331-31421. So I'm going to demonstrate how to perform a modified knots test. You want to make sure you have all of your necessary supplies. So this is going to be a 15 ml centrifuge tube. You also want to have, I've got 9 mLs of 2% formalin, and I have 1 ml of anticoagulated blood. So the first thing you're going to do is you're going to remove your top. There we go. And I'm going to add all of my formalin. That's 9 mLs. And my 1 ml of anticoagulated blood. I'm going to put my top back on. I'm going to invert it really well several times. Alright, that looks pretty well inverted. So now I'm going to walk it over here to our centrifuge. I already have an equal balance in there, so I've got that. I'm going to put this directly across from it to keep it balanced. I'm going to close my lid. I'm going to make sure we're set to 1500 RPMs, and we're going to set our timer for 5 minutes. Alright, so our sample just finished spinning in the centrifuge, so we're going to go ahead and discard of the supernatant. So I'm going to go ahead, this all done. I'm going to use my pipette here. I'm going to remove it just a little at a time so that I don't disturb the sediment at the bottom. So what we're going to be looking for a modified knots test is we're going to look at concentrated microfilaria and see what we can find. Almost done. Alright, there we go. Don't want to disturb that sediment at the bottom. And so now I'm going to go ahead and add 1 drop of the methylene blue. Put that right in there. There we go. Put that down to the bottom.
Yes, sir.
And I'm going to go ahead and just pull up 1 little drop. Go. Take my slide. So put 1 drop on there. I'm going to take a cover slip. And place it as well, right on top. And now I'm going to look at it on the microscope under the 10 times objective. So look at that on there. Turn that on. Right. See if we can get a good view of this. Alright. So I'm going to start in the top corner and just kind of work my way down and all around. That way we cover the entire lens. Let's see.
If somebody messes up, it'll show that and then I'll get rid of it. I guess, well, this one is make sure not to get through. And so I emailed them and I was like, yeah, like I just canceled my subscription. I did not authorize $150 and that answered me like all morning. He was like real quick to answer back pretty much.
And here we go. So I actually see this looks like a dirofilaria. It's right in the center of the screen. I've only seen 1 thus far. I don't know if we're able to see if the camera can look into it. We can attempt. So I'll keep on scrolling and see if I see any more, and I will definitely make sure I inform my doctor. So today I'm going to demonstrate how to do a fecal flotation. So I've got about 2 grams of stool sample right here. And I'm going to go ahead and open that up. And I'm going to pour some of this sodium nitrate fecazole into it. Let's see. And I'm going to mix it together well. See, I'm going to use just a fecal loop here. I'm going to mix it up really well. That looks pretty thoroughly mixed. And now what I'm going to do is I'm going to open up a new container. And I'm going to take just a piece of gauze. I'm going to spread that open and cover the lid with. And And I'm going to pour my sample in here. That way it's gonna, all the liquid is gonna go into the container, and any of the bigger chunks are gonna stay in the gauze. Alright, perfect. So we're gonna take that gauze out. And we're gonna discard of that. Alright, we're gonna now take our fecalizer container. We're gonna pour what we have in there. Back in and fill it to the top with our fecasol. We're going to make sure we create a little meniscus on the top, which is that little dome, a little bubble on top. And now we are going to put a clean cover slip. Okay, and we are going to set our timer for 15 minutes. And when that timer goes off, we can go ahead and read our sample. Okay, so now I'm going to demonstrate how to do a fecal flotation with the centrifuge. So it starts off the same as a fecal flotation. I have around 2 grams of stool sample right here. I'm going to go ahead and pour in some sodium nitrate with it. I'm going to thoroughly mix it. Pretty good. So I'm going to take a container and just a piece of gauze. I'm going to cover my clean container with the gauze. I'm going to slowly pour in my sample so all the liquid will go in the new container. And catch all of the stool sample on top. Discard of this. I'm going to do it one more time to collect a little bit more. That looks pretty good. So we've got our sample in there. Now I'm going to pour that into our tube right here for centrifugation. And I'm going to fill the rest of the way with the sodium nitrate. However, I am going to leave a little space at the top. There we go. Put that on there. We're going to come over here to our centrifuge. And we are going to spin this down for about 5 minutes at 1300 RPMs. You want to make sure that you're balanced, so we have an equal size balance already right directly across from it. So I'm going to go ahead and turn that on. Everything is all set. And we're going to run it for 5 minutes. Our fecal sample just finished centrifuging, so I'm going to go ahead and remove that. And here we have it right here. I'm going to bring it back over to our station. I'm going to remove our lid, place it in here, and I'm going to pour a little bit more of the fecasol just until we fill it up to the top and create that meniscus, that little bubble right on top. Here we go. I'm going to place a cover slip, and we're going to set our timer for 15 minutes. And then after 15 minutes, you can come back and read your sample under the microscope. The reason you might want to do a fecal float with a centrifuge over just a plain fecal float is because it is a little bit more sensitive. It's going to recover more eggs and cysts. Now I'm going to demonstrate how to perform a direct smear. So direct smear is just a really quick way to look for parasites. It's really good at picking up GRE if somebody has that, so this is a good one for that. What you're going to do is you're going to take just a tiny little bit of fecasol and you're going to place that on your microscope slide. And then you're going to try and put about equal parts of the stool sample on that slide as well. There we go. And you're going to try to mix it together really, really well. Mix it really well. Alright, and then you're going to go ahead and take a cover slip. Remove your gloves so you don't contaminate the rest of the cover slips. Take a single slip, place it on your slide, and you are ready to read your sample. Now I'm going to demonstrate how to perform a fecal sedimentation. So I've got about 2 grams of stool sample here. I'm going to go ahead and take that off. I'm going to go ahead, it's very similar to a fecal flotation with a centrifuge. However, instead of using fecal salt, I'm going to use just plain water from a sink. So I'm just going to pour a little bit into real quick. Plain old tap water is fine. Got that in here. I'm going to go ahead and mix that really well. And break it down as much as I can. Alright. Now to take the other test, I'm going to use the clean container and my gauze. Go ahead and strain the sample. Perfect. Now I'm going to pour that into my centrifuge tube. Alright, we'll fill it the rest of the way. Oh, nope, actually I think I have enough to... Perfect, I'm going to leave a little gap at the top. We're going to come over here to our centrifuge and spin it down. I make sure I have a balance directly across from it. I spin it down at 1300 RPMs for 5 minutes as well. Okay, so now that our fecal sedimentation has finished centrifuging, I'm going to go ahead and remove all of the supernatant from the top. And so I'm just going to go ahead and inject it into... I just want to make sure that I do not disturb our sediment at the bottom. Alright, there we go. Got all that supernatant out of there. Now I'm going to put a new tip on. And I'm going to remove just a little bit of that top layer of the sediment. There we go. I'm going to put it onto my microscope slide right here. And then I'm going to take off my glove so that I don't infect any of the cover slips. And I'm going to take a single cover slip, set it on my sample, and then that is ready to read under the microscope. You already canceled. Okay, cool. The reason that you want to check fecal sedimentation is because it's going to help you find eggs that are a little bit too large to find on a regular fecal float or on a float with centrifuging. So parasites such as flukes, their eggs are too big to be seen on a float. So you want to make sure you check their sedimentation. I'm going to demonstrate how to collect a free catch urine sample on a dog. So you want to make sure you have all of your necessary supplies. That's going to be a clean, dry container to catch the urine with. And you want to make sure that you have your dog on a leash. That way you are close to them for collection. That way you don't scare them when you go to collect your sample. You want to make sure you collect your sample midstream, which means you're going to let her urinate a little bit. Then you're going to slide the container underneath to collect the rest of the sample. And then remove it hopefully before she finishes urinating. The reason for that is because there is all sorts of bacteria on her fur. And it could contaminate your sample. Your depleted samples tend to have an increased white blood cell count. And so it can lead to false results. You also want to make sure that you try to collect your sample at the beginning of the day, hopefully with that first morning urine before you've had anything to eat, as that's going to be the most accurate sample, it's the most concentrated. So we're going to go ahead and take Blue out and see if she'll urinate for us. Come on, pretty girl. Good girl. She's quiet. A sample. And here we go. Here is our free catch urine sample. So I'm going to demonstrate how to perform a cystocentesis. So you want to make sure you have all of your necessary supplies. You want to have around a 10 ml syringe with a 1.5 inch needle on it. And then you want to have a sterile tube and then an extra needle to go ahead and move your sample into. So there's a couple different ways to get a cystocentesis. You can do a blind stick, which is where you're just palpating the abdomen to feel the bladder and getting your sample that way. You can also use ultrasound guided technique, which is what I'm going to use today. And so we can go ahead and roll the girl into position. Hi, baby. All right, so I'm going to go ahead and I'm going to just spray her down with a little bit of alcohol so that my ultrasound, the wand can read. And I'm going to go ahead and direct it at her ventral midline. I'm going to make sure that I am caudal to the umbilicus. And so let's see if she has a bladder.
You're okay.
There's her bladder right there. I'm going to take my syringe. I'm going to go the same angle as my probe. And I'm going to pull back on my syringe. And that's enough I need. I'm going to go ahead and slowly back out. And there's my sample. You always want to make sure that you never redirect when you're in the bladder, as that can cause any perforations. And so now I'm going to go ahead and remove the contaminated needle. Put on a brand new one. And then I can save my sample in this vial right here. I'll make sure I label it appropriately with her name, the date, how it was retrieved, which is cystocentesis, and I will also mark her ID number on it. So I'm going to demonstrate how to place a urinary catheter today. There are 3 different types of urinary catheters that you can use. The first one is a Foley catheter. It has a cup on the end that you can blow up for more long-term use. There's also a polypropylene catheter, which is a little bit more rigid, and it's good for pulsating bladder stones. So it's good for, say, if you have a blocked cat. There is also a red rubber catheter, which I'm going to be using today. It's a little bit more flexible, and it's good for the relatively healthy dog who you just need to obtain a urine sample to go ahead and send out. You can send it for a urine culture and sensitivity test if you need to. So the very first thing I'm going to do is I'm going to go ahead and I'm going to scrub his sheath and get it nice and clean. So I'm going to do 3 layers. I'm going to go ahead and do the Chlorhex. And then I've got some saline scrub. 3 times each. Yep, I've done that. I'm going to go ahead and put on my sterile gloves. There we go. And then Brooke is going to come in and she's going to put some sterile lube on that clean piece of paper. And she's going to open up my urinary catheter. Thank you. So the first thing I'm going to do is I'm going to measure it to the dog. And we're going to see if we think this is going to reach his bladder. And it looks like that'll fit pretty well, so I'm going to go ahead and lubricate the tip. Okay. And all that in the hand. Okay, so now I'm going to go ahead and I'm going to go ahead and try to extrude the penis. Thank you. Make sure that's on there. Will you show that that's on a sterile field? Thank you. And I'm going to have Brooke go ahead and hold the sheath for me. Okay. I'm going to go ahead and place my catheter.
Okay.
Have a border up front, please. A border up front. Thank you.
I'm just going to feed it. Yeah, I told her. Feed it until it reaches his bladder. go. So almost, we get pretty close to the end.
Hey, Jamie. No, sorry. Her next one's in one.
And so you're going to let the first little bit of urine drip out. That way you get an uncontaminated sample. And then she's opening my sterile syringe for me. I'm going to go ahead and attach it as best I can. And then you can break my seal. Pull your sample that way. That we can send it off to the lab as sterile as possible. You can send it for a urine culture and sensitivity test. So we got our urine sample there. It looks pretty clear, not very cloudy at all, and I call it pale yellow. And then to go ahead and remove your urinary catheter, you just want to gently pull it out. And always make sure when you're getting your sample in a syringe, you just gently aspirate it. You don't want to pull too hard. We're just going to go ahead and slide that out. And that is how you place a urinary catheter. So this is Jack, and he presented today with a 4-day history of shaking and scratching at his ears. So his mom brought him in to get those checked out today. I'm going to go ahead and get a swab from each ear because he has been scratching at both. And we're going to be looking under the microscope for any sort of infection. So that may be bacterial, that may be a yeast infection. And so I'm going to go ahead and get a swab from his right ear first. Hey, buddy. Swabbing motion. There we go. I'm going to make sure that doesn't touch anything to be contaminated. And I'm going to get his left swab as well. Good boy, buddy. And I'm going to go ahead and break that left one so that I know which ear is which. And then over here I've got my slides listed left and right. I'm going to go ahead and do the right swab and the right foot. So I'm going to go ahead and just roll it. Gently roll it. And it looks like it might be a little bit waxy. So generally you want to let them sit for air dry for 5 to 10 minutes. But because it is a little waxy, I might leave it probably closer to 15 minutes. That way it dries appropriately. We'll do the left one now. Get that second one. And we're going to roll. Alright, so I have got my samples on my slides. I'm going to let them air dry for about 15 minutes and then we'll come back and stain them out with you. Okay, so now that our slides have finished drying, we're going to go ahead and stain them out in our Romanowski stain. So just for the sake of not going over my time allotted for the video, I'm going to just do one of the ears. So this is the right ear. It says AD on there. And so I'm going to dip it for about 20 seconds here in this blue stain. Keep track of that on my watch. Alright, now I'm going to do about 30 seconds in the red stain. 40 seconds in the purple stain. So now I'm going to go ahead and really gently rinse off my slide. And I'm going to blot it with my bibulous paper. I'll be really gentle with that to make sure you don't crack your slide. And we'll just do that a couple times until it's nice and dry. Alright, that looks pretty good. So now I'm going to go ahead and read it on the microscope. And I'm going to start out on the scanning lens, which is the number 4. Alright. I'm going to bring it up until it's in focus. Alright, now that I can see on there, I'm going to move up to the 10. Get it focused there. Alright, I'm going to go to the 40. Make sure I can see it there. And then next you're going to go to your 100, which is your oil. So I'm going to go ahead and place my oil on there. Make sure I don't let it touch any of the other lenses. Alright, let's see. Now we're going to start scanning. Nice and in focus. Let's see. some skin cells in here. There's a little bit of yeast so far. Look around and see if we see anything else. Okay, let's see. I'm not seeing anything else besides just a little bit of skin cells, a little bit of yeast, and so I would probably call this about 2+ yeast. It's not super overbearing, so I will go ahead and see if we can kind of get a view of that on the camera. Let's see. It's kind of difficult to do sometimes, so we'll do our best. If we can't get it, that's okay. Let's see if you There we go. You can kind of see a little bit of the yeast in there. There we go. You can see a little bit in there. All right. And so that is how you read an ear cytology. Okay, so I'm going to demonstrate how to perform a skin scraping on a dog. So skin scrapings are used to look for any sort of infection or mite that might be on the skin, some external parasites. Usually a dog that needs a skin scraping or a cat that needs skin scraping is going to have some hair loss, some dry skin, flaky, itchy, something like that. So you're going to use a 10 blade, and you're going to make sure that you use your 10 blade backwards, and you're going to hold it perpendicular to the skin. That way you're less likely to slice the skin. And over here, I'm going to grab a little paper towel real quick. I have got my microscope slide, and I've got some mineral oil. I'm going to go ahead and place a drop of this mineral oil on my slide. There we go. Just set that up here on the counter, like easy reach. I'm going to open up my blade. There we go. I'm going to go ahead and dip it in a little bit of my mineral oil. Hi, buddy. And ideally you want to pick a spot that's got that hair loss, a really dry spot. So I'm just going to go right here. I'm just going to scrape, 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 and I'm just going to do a superficial scraping on him. We don't need to draw blood. We're not looking for any deep parasites. If you suspect that they have mites that are living in tunnels, you want to scrape a little bit harder until you draw a little bit of blood. However, we don't suspect that from him. So I've got a pretty good sample right here. I'm going to go ahead and tap that into my mineral oil here and scrape off all the excess. And then if you guys will follow me around, you can go back to his cage and we're going to go look at this under the microscope. Alright, so we're going to go on over here. Come on, Bubba. And we are going to read this on the number 4 objective, that's our scanning lens. Right, I'm going to see if he's got any parasites. Alright, so surprisingly enough, it looks like there's just a little bit of dirt and debris and a little bit of strands of hair. I don't really see any external parasites in this sample. I don't know if we're able to, we can try and show you with the camera lens. It may or may not work. But, there we go. Alright, and that is how you read a skin scraping.